Ladies and gentlemen, it's an honor to stand before you today. I am Dr. Ravishankar, a cardiac surgeon, Ayurvedic doctor, a researcher, and applied mathematician, pioneering the integration of ancient Ayurvedic wisdom with modern medical science. As the developer of polyscientific Ayurveda, I have spent years in translational research. More than 3 decades have passed, friends, and have successfully modeled Vata, Pitta, Kapha in experimental animals and identified more than 3,000 biomarkers for these fundamental Ayurvedic principles. With a background in data science and Python programming, I hold 58 patentable technologies, numerous trademarks, and have published over 100 scientific papers. I'm also the creator of Dr. Poly, a revolutionary device that measures your VPK42 fingerprint, transforming the way we practice Ayurveda. Now let's delve into why this integration is so crucial, friends. Having closely observed the limitations of allopathic medicine, one prime example is diabetes management. If you ask, what is diabetes? It's essentially a condition where the body struggles to metabolize glucose. But the complexity begins when different associations set various standards for HbA1c levels. For example, the American endocrinologists recommend keeping it below 5.5. The American diabetologists target about 6.5. The American College of Physicians suggests between 7 and 8, and never below 6.5. And geriatric associations recommend it maintaining it between 7 and 7.5. And in fact, certain studies like the Accord trial and the VADT trial have shown better patient outcomes with 8.5 or even 9.5. This conflicting guidance stems from the recognition that glucose metabolism is not linear, friends. It is influenced by countless factors, including the body's doshic constitution. In my research, when we modeled Vata, Pitta, Kapha in experimental animals, we discovered that these doshas drastically alter the pathways in which the glucose is metabolized. For example, in Vata environment, the glucose primarily degrades into pyruvate or lactate, generating only about 2 to 8 ATP molecules. In a Pitta environment, the glucose is fully oxidized into carbon dioxide and water, producing a full yield of 38 ATP molecules. And in a Kapha environment, the glucose undergoes chain elongation, forming polysaccharides like glycogen, reducing the demand for ATP. What does this tell us? That the Vata, Pitta, and Kapha framework plays a critical role in determining how glucose is metabolized, friends. Vata dominant individuals require more glucose as their tissues are hyperexcitable, which we measured in our electrophysiological studies in animal models of Vata. And this leads to rapid ATP depletion. And on the other hand, Pitta individuals exhibit heightened mitochondrial activity and producing excess of ATP, while kapha systems are hypometabolic and they need far less energy. From this data, we have learned that glucose management needs to be customized based on the individual's VPK constitution, friends. And for instance, Vata and Pitta individuals may need higher HbA1c levels to maintain metabolic balance, while kapha individuals with their lower energy uh, require maintaining stricter controls. This explains why different guidelines are all correct, just under different constitutional context, friends. Hence, before we attempt to treat diabetes or any other disease for that matter, understanding the VPK42 fingerprint of an individual is absolutely essential. This quantification helps us accurately determine whether a patient is Vata Prameha, Pitta Prameha, or Kapha Prameha as described in Ayurveda before beginning treatment. Additionally, the Dhatu Dosha principle within the Ayurvedic framework must be incorporated into the diagnosis. And for this reason, we advocate for the VPK42 fingerprint as a cornerstone of personalized medicine. This fingerprint guides not only the dietary recommendations but also the specific formulation of yogasanas, the herbal extracts, and the form in which these are delivered, whether kashayam, gruta, asava, arishta, depending on the individual doshic imbalance, friends. And that brings us to our most exciting innovation, the Dr. Poly device, friends, which is objectively measured uh, which objectively measures the VPK42 fingerprint and has the potential to revolutionize the practice of Ayurveda, making it as precise and scientific as the modern medicine. This device is poised to place India at the forefront of global healthcare, friends. Thank you very much for your attention, and I look forward to a future where Ayurveda and modern science work hand in hand for true and holistic healing, friends. Thank you very much.